Hi, I'm Dr. Ron Samoji.
And I'm Dr. Waqas Jalil.
The purpose of this video is to give you a brief overview of the procedure.
But remember, the most important first step in your surgical journey is a consultation, and we look forward to seeing you then. Body contouring is generally a term that we use specific to people who have lost an extreme amount of weight. In specific circumstances, people who have lost an extreme amount of weight may see a lot of changes to the areas of their body. These areas of their body can generally include their arms, chest, abdomen, thighs, or even posterior trunk. Since we are addressing so many areas of their body, we generally call this term body contouring.
The ideal patient for body contouring after massive weight loss has a number of features. The first and perhaps most important is that they are of stable weight and ideally at the weight that they want to be long term. This means that we can contour things in a way that's going to last a very, very long time and that patients are going to be very happy with. The second, which we spend a lot of time talking about, is scar tolerance. These are usually quite significant surgeries with large scars to resect or remove a lot of that extra skin that's bothering the patient. This, of course, leaves behind scars. These generally heal well, but they are visible in many cases and they really don't ever go away. And so scar tolerance is very, very important. Budget is another thing that we talk about. We talk about it at the very first minute that we meet patients because we need to be realistic. In patients that have lost a lot of weight and have a number of areas that need to be addressed, surgery can be long, there can be multiple surgeries, and of course costs can be significant. And so we put all of that on the table early on so that we can help patients plan for all of this. Finally, we spend a lot of time talking to patients about realistic expectations. Depending on how much weight has been lost and the degree of extra skin or remaining extra fat, how many procedures we're going to do, we need to be realistic about the result that we're going to be able to obtain. In some cases, it's simply removing that extra skin so that patients can get back to their normal, comfortable life. And in some cases, it's truly contouring and restoring patients to a more athletic, more sculpted look. That really depends on what we're starting with and what procedures we're going to choose. The options in body contouring after massive weight loss are really individualized. They really depend on what the biggest issue is for each individual patient. Some patients come in really concerned about their abdominal area, with the breast or arm being secondary, and some patients may come in exactly the opposite, with the arm or even the thigh as their biggest concern and the abdominal area being secondary. And so we'll have a detailed conversation with every patient to really outline what the priorities are. We'll then choose procedures for each of those areas and try to combine as many of these together to result in the fewest number of surgeries with the best possible results. The general risks of any surgery include things like bleeding, infection, blood clots, anesthetic complications, some degree of discomfort or pain after surgery, and some downtime, your inability to do some of your normal daily activities or exercise for a period of time.
The specific risks to body contouring after massive weight loss can include asymmetries, scarring, and additional procedures to improve contour.
Specifically with regards to scarring, we tell patients that this is the ticket to the show. The show is an unbelievable contour, and the ticket is the scar that's going to remain. In patients where we have to remove a significant amount of skin or fat, whether that's in the lower abdomen, the breast, arm, or thigh, these are generally visible areas. Where you see that extra skin, that's where that scar is going to be. Now, these scars, although very visible immediately after surgery, do fade quite a bit over time, almost in some cases to be imperceptible. But there are many things that we do during surgery and after surgery to help in that process. Of course, we hide scars wherever we can, in underwear or clothing lines, in body creases, things like that, so that the scars themselves are not visible in most cases. And we'll also do things after surgery to help scars fade. That can be using special creams or gels, it can be laser treatments, injections, different things that in the end will allow for scars that are really quite reasonable given the amount of skin that's been resected and given that our primary goal is really that contour of whatever area we're dealing with. With regards to asymmetry, this really depends on the degree of the procedure that we're doing. In patients that have a lot of extra skin and a lot of extra skin in two parts of the body, like both arms or both thighs, we are really trying to match one side to the other side, and that's often very, very difficult. People heal differently, people gain or lose weight differently, and so asymmetry is something that we're always battling. In the end, what we hope is a result that's very, very close one side to the other, not perceptible to the average person, and in some cases where there is some asymmetry that's visible or obvious, some revision procedure may be required to tighten up the skin on one side or the other. The third are revision procedures, which I just touched on, and that's in the future. With any patient that's lost a lot of weight, the skin has lost its elasticity and some of those healthy things within the skin that help it heal and remain tight over time. With that in mind, when we tighten skin in these body contouring procedures, we do see some loosening of the skin in the years to follow. In some patients, this is really not obvious, and in some patients, it's a little bit more obvious. And in those patients, we'll often come back and make some small revisions to retighten or recontour certain areas. And that's what we mean by revision after a body contouring procedure.
Body contouring can be a really life-changing experience for a patient. Generally speaking, when we have patients come in, their surgery can range from 4 to 6 hours, and after surgery they can find themselves waking up in specialized body garments that are applied for at least a period of 4 to 6 weeks and even extended to about 2 to 3 months. After these garments, they may also notice that drains are also present in the various surgical incisions. These drains work as an effect to decrease swelling and also prevent seroma or hematoma formation underneath the skin. After surgery, some patients can opt to stay overnight or even go home. As patients go home, we do see that they are able to resume most normal activities. However, physical activity in the form of weightlifting or going to the gym is discouraged. Follow-ups with us include usually a follow-up at 1 week, 3 weeks, and 6 weeks. At your follow-up appointments, we generally like to check up on things such as, are your incisions healing well? Is there any presence of infection? And again, any presence of fluid accumulation underneath the skin, such as seroma or hematoma. So this is an example of a very typical male after massive weight loss. In this example, you can see that he's lost about 75 pounds through normal diet and exercise. We discussed several incision options related to improving his abdomen. After having the discussion, we actually opted to do a lower body lift, which is a circumferential or 360-degree abdominoplasty. Scar placement was a really important aspect to him, and as you can see in some of the photos, the scar is nicely placed and hidden in the underwear line, but the improvement in contour that he's received is immense, and he's really happy with his results so far.
In this example, we see a combined procedure where multiple areas are contoured at the same time. This patient is 45 years old and comes in after over 100 pounds of weight loss. She has significant excess skin of the abdominal area, both in the front and the back. She has droopiness of the buttock and lateral thighs, and she has ptosis or droopiness of the breast with deflation, with a lack of volume. Given that she is a healthy young woman, we elected to perform a number of procedures at the same time. You can see after that she has had a circumferential abdominoplasty or body lift. This addressed the loose skin of the abdomen as well as lifted the lateral thighs and buttock. And you can see that she's had an augmentation mastopexy, where we've tightened the breast tissue, lifted the nipple into the appropriate position, and placed a silicone gel implant to provide the volume that she was lacking. She is shown here 6 weeks after surgery with a significant improvement in contour, and she's very, very happy with her results. In summary, body contouring after massive weight loss surgery is a large endeavor for patients. It can include significant surgery and multiple procedures often included. The results are life-changing. Patients do very, very well for this when looked after in the appropriate manner. Patients should come in for consultation so that we can really decide where the priority areas are and which procedures can be combined for the ultimate results.